ultimately too many people going into hospital that didn't really need to go.
We can get them off the floor much quicker. That reduces the effects of those long lies.
A very simple solution to what had been a very major problem.
We were very much aware that our ambulance trust was struggling to respond to falls, and they were resulting in people both in care homes and in the community laying for a long time on the floor.
So before we implemented the Raizer chair and the HelpFall app, the staff would do their quick assessments. Often, initially, to cover their own back, they would be wanting to call 999 to get help and support.
Ambulance waiting times could be up to 6 to 8 hours, especially during COVID, and that was very uncomfortable for the people who were on the floor. It also led to a lot of health complications from the effects of long lie.
The staff that we've spoken to felt quite helpless, and there was not much they could do during that period other than just comfort that individual and kind of wait for the ambulance to arrive.
So even though they hadn't been injured first thing in the morning, by tea time they were finding themselves being taken to hospital, which was very distressing for the person and distressing for the staff to watch that happen.
Then when they go to hospital, you know, the kind of treatments that they were having to have are obviously longer. Their stay in hospital is potentially longer as a result of that fall and that long lie.
So we got like-minded colleagues together and had a working group to look at the scale of the problem in Northamptonshire. So started to engage with our council colleagues to look at actually how could we solve this problem.
So we've worked really closely on this project. It's been the first project that I've been involved in that we've had health, NHFT and both councils working in partnership to try and get the best outcomes.
We worked with our ambulance colleagues and we did an options appraisal on different lifting devices, and we felt that the Raizer offered the easiest device, it was the safest device, and also because it got the helpful decision tool, actually we could validate the lifting that was being done, and we'd got some quality outcomes and some governance around it.
The company came and gave us very good training, so the staff felt very comfortable and very confident.
So using the HelpFall app is the first thing we do when someone has a fall. We initially make an observation of how they look. Obviously, sometimes it's clear that a hospital 999 call is going to have to be made. Sometimes there can be questions that you think, oh, I'm not sure about this, I'm not sure about that. But with the app, you sort of have a list of standard questions and it gives you straightforward, simple answers, and it will move on to the next stage. Yes, you can move on to the next stage. No, immediately call 999.
The Raizer project has been a game changer. It can go into confined spaces. You don't really have to move the person too much before lifting them off. It literally scoops you off the floor.
So using the Raizer chair definitely maintains dignity for the resident, and they feel much safer using it because the chair takes all of the support for them, and then it allows less staff to be involved with assisting from the floor as well.
If people are lifted off the floor in a timely way, we don't then see the complications. We then don't see people waiting in hospital for more complex kind of situations where they need additional care because of the complications of a long lie, and therefore the pressures on adult social care are less.
The residents sat up in a comfortable position, they're not laying on a cold floor, so that's beneficial for them straight away.
We now can monitor the data that we get from the East Midlands Ambulance Service, and we can clearly see that there is a reduction in those ambulance call-outs, and that is all because we can now get people who have fallen and it's been a non-injurious fall. We can get them off the floor.
So from finding the person fallen, we have had them back up and sitting in a chair, drinking a cup of tea within half an hour, which is absolutely magical.
the evidence is really clear that it's had a really significant impact, particularly with some of the homes that have had quite frequent fallers. And you can see the increase in confidence with the care staff as well.
So the Helpful Decision tool is a tool that has got red, amber, green triggers on it. It's very safe. It's been developed with ambulance chief execs in the past, so it's a very effective tool and it follows NICE guidance.
The HelpFall app is our governance tool and also been very useful in supporting the staff with their decision making as to whether the person can be safely lifted.
The benefits of having the HelpFall app and the Raizer chair has been able to give them a bit of confidence in, can I move this person straight away off the floor rather than leaving them for 2-3 hours waiting for the ambulance service.
So it helps the staff which are not clinically trained to come to that decision and to also get people off the floor as soon as possible, reducing those ambulance call-outs and the waiting times.
The benefits to the system is that the system can have confidence in the care homes, getting people off the floor and not needing the help of EMAS and putting the pressures on the ambulance services, and so that the benefits can be seen all round.
One of the things that we wanted to do next was ensure that people on the ground were absolutely referring on to other services so that people were getting that appropriate follow-up, medical assessment and review. So we wanted to adapt the HelpFall app so that it guided them as to what to do next.
It's definitely beneficial to have the HelpFall app customized because it signposts you to the services that are around. It gives you the contact details. So when you use the HelpFall app, you have got the list of services there that you can signpost to or contact for help, and it also gives you the contact details of those services, and it also keeps a record of how the fall was followed on.
It's always our first port of call to use the HelpFall app and the Raizer chair, and yes, categorically, absolutely, has saved many ambulance calls.
Since we've had the Raizer chair and the HelpFall app, I would say our calls to the emergency services has reduced by about 70%.
So we only started it late summer and it has really taken off and progressed. To date, there's been 120 lifts in a very short space of time. Only 8% of the 120 actually required an ambulance taken to hospital. So that's absolutely amazing. That means that those people that really need to go to hospital can have that ambulance and go. Staff know how to look after them whilst waiting. It also showed that 28% of them were minor falls as well, minor injuries. So we're now enhancing our programme by overlaying minor injury training, having trauma wound care boxes. Some of that 28% will be referred on to our rapid response team who will go out in 2 hours. So all around the focus of getting that person the help they need quick, getting them treated quickly, making sure they then have that follow-up medical assessment, but only calling the ambulance if we absolutely have to. So the majority of people actually weren't injured, got up safely and just went about their business. Working with Felgains, we've got access to a dashboard to see all this data coming in. The dashboard enables us to kind of match the things together to make sure that what we're doing is safe and effective.
For us as a home, the local authorities being able to give us equipment that's going to reduce hospital admissions, support staff in training, embedding good practices into them, it is absolutely crucial.
We are hoping that through the data that we're showing, we're able to get some more funds so that we can buy more chairs and take that out to more homes.
I think we're both really excited with being able to roll this out further and wider. It's had such a positive impact. We know there are more homes that we could potentially target and deliver that training to. There's the opportunity to explore voluntary sector and how we can engage our communities to be part of this solution as well. So I think there's obviously lots more opportunities that we can look at.
And it's looking at how we can work together across our councils and health and Felgains as well, and looking to see how can we give people in the community access to this equipment.